Hello, people. My name is Dr. Sahu. I'm the director for Revive Hair and Skin Clinic. I'm today going to talk about the non medical treatments for male pattern hair loss. The reason for selecting this topic is that I often get a lot of clients who come in asking for hair transplant surgery. They're often quite young, and hair transplant is, in my opinion, not the best treatment for them at their stage of hair loss. And on further prodding, I find out that it's because they don't know that there are other options available for them that would be more appropriate than hair transplant surgery. And again, hair transplant surgery is not the answer for everybody. It doesn't work for everybody. For some people, other options might be more appropriate. So, anyways, I'm going to focus on finasteride, which a lot of you might know by the name of Propecia, and the other one is Minoxidil or Rogaine, which is a topical application. There are other non-surgical treatments as well, like low level laser therapy and platelet-rich plasma therapy. But I'm just going to focus on the medical treatments. I'm going to talk about minoxidil first. Minoxidil is a topical application. It's available under the brand name Rogaine. 2% minoxidil is licensed for use in women, and is the 5% that we use for men. It comes in a liquid form and a foam formulation. I personally feel the foam formulation is better because I think patient compliance is better with the foam form. The hair is easier to style, and also there's reduced incidence of side effects and allergies because there's no propylene glycol in the foam formulation. The advice is to use it twice a day. I can totally understand if some of you can't use it twice a day, but even if you can manage once a day application, something is better than nothing. You will still see results even if you use it just once a day. The way it acts is by increasing the blood supply to the hair follicles. So there is often an initial period of shedding which can occur in the first few months. There's no need to panic. It's expected that it should calm down, and the hair usually comes back. It's because the hair before they enter the growth phase, due to the increase in blood supply, will often be shed. That just is a normal part of the cycle of the hair growth cycle. So the hair does come back. The results can take up to 3 months, 3 to 6 months. It varies from person to person. So you have to persevere. Side effect wise, I'm not going to go through all the side effects. I'm just going to focus on the more common ones. The list is a long one. You can certainly have a look at the leaflet when you get the medication. It's more the local side effects, like it might cause redness or swelling or itching, things like that. And if you don't tolerate, obviously go and see your hair transplant surgeon. In the UK, Rogaine is not available under the NHS. It's only available privately. You don't need to see a doctor. Well, you can see, it's ideal if you see one, but you can actually get it from the pharmacist after going through a short questionnaire to make sure it's the right treatment for you. The effects of treatment, the effects from minoxidil last as long as you take it. Once you stop applying the medication, you're going to lose the beneficial effects, and the hair loss will come back. You can continue using it for as long as you want. It's quite safe to be used in conjunction with finasteride tablet. You can also use it before and after a hair transplant surgery. So I'm going to now talk about finasteride 1 milligram tablets, which a lot of you also know as Propecia. In the UK, it's available only under prescription, only through a private prescription. It's not available under the NHS. Now I understand it can also be bought from the chemist after a short consultation. I think it's best you see a hair transplant surgeon to make sure this is the right treatment for you, and also so that you can be counseled about the risks and the side effects, so you know what to watch out for. So the way it acts is by inhibiting the change of testosterone to another form of hormone called as 2-dihydrotestosterone. Testosterone is the main male hormone, and 2-DHT is one of the other active forms of testosterone. This is the form that mediates male pattern hair loss. So by inhibiting that conversion of testosterone to 2-DHT, the finasteride helps in significantly reducing the progression of hair loss. A lot of people come in and say that can finasteride replace hair transplant surgery? The answer really is a no, because it does not completely stop the hair loss, but it can definitely buy you enough time until you have your hair transplant. Sometimes as we age, men might be happier with a higher hairline and a slightly reduced density. So often expectations change as we age. So I have seen a few patients who are on finasteride, and often with time they're actually happier with their hairline, they're happier with the hair they have after using finasteride, and they just either postpone the idea of having a hair transplant or completely stop thinking about it because they're so happy with the results. But again, patient results vary. Everybody is unique, so you can't expect exactly the same results with everybody taking the tablets. So I've talked about the mechanism of action. Going to the risk factors, going to the side effects, the most talked about side effect is sexual side effects. It can cause a reduced amount of semen, reduced libido, and erectile dysfunction. Now, luckily, only 2 to 4%, between 2 to 4% people have the side effects, and majority tolerate the drug really well. There have also been reports that sometimes with continued use of the finasteride, these side effects can regress over time. We've also had a few reports, read about a few reports where the side effects have persisted even after the medication was stopped. There is no way to predict who is going to be that person who will have persistence of the side effects. Nobody can unfortunately predict, but thankfully, as I said, majority of people don't have any problems taking the tablet. So this is the most common side effect. You should obviously go through the list so you're aware of what other things you need to look out for. There are other side effects and risks which are very rare, but you will find them listed in the drug information leaflet. Now I'm going to talk about the risks. There are a few isolated cases of male breast cancer, but there are very few cases, and therefore I'm unable to give you a percentage or a number. There haven't been any studies done to look into that. Also, to inform all of you, finasteride can affect the levels of PSA. PSA is a marker used to check for prostate cancer, and finasteride can reduce the levels of PSA. So if you're having any problems, bladder dysfunction, anything that you might associate with a prostate problem, you need to let your doctor know that you are on finasteride, because finasteride can give a falsely low level of PSA. So that's something which needs to be taken into account while you are investigated for any prostate issues. The other thing is that finasteride is metabolized through your liver. So if you've got any liver problems, let your hair transplant surgeon know about that. Some people, again, minority, can get a lump or tenderness around the breast area. Sometimes they can get something called as gynecomastia, which is more to do with the cosmetic appearance and can sometimes cause some psychological distress to people. That's again something you need to be aware of, and obviously come and have a discussion with your doctor if that's something that has concerned you. I think I've covered the majority of the side effects, what you need to watch out for. Again, similar to minoxidil, You can also have shedding with finasteride, which then it can occur in the first few months. Again, it stops and the hair does come back. It's the shedding happens before the hair enters the growth phase. So there's, again, people, nothing to panic. Persevere, stay calm, and it will get better. The it can take 6 to 12 months to see the full results from finasteride, and you can start seeing results sometimes as early as 3 months, but for full results you have to persevere for at least 6 to 12 months. Again, minoxidil and finasteride, both these medications are safe to be taken together. They can also be taken before and after hair transplant surgery. They're also safe to be taken along with if you choose to have a PRP therapy, or if you choose to have a low-level laser treatment. So I'm hoping I've covered most of the questions that I usually encounter when seeing clients. But if I've left out something, if there is something that you guys want to know about more, then please feel free to contact the clinic, or you can see the email at the bottom of the screen. Feel free to email me on that, and I will get back to you with your queries. I think that's it for today. Have a lovely day. Bye for now.